The next thing that we're going to talk about is the spinal exercises. So like I said earlier, everybody should be doing some kind of daily routine of spinal care. And these exercises are the first level of what you can do. Think about this fact.
Sorry. Try silencing it.
If you looked at the circulation in an 18-year-old person, you would see that there are arteries that are bringing blood to the spine. These arteries go into the discs and into the bones of the spine. They're bringing oxygen, nutrients, all the things that are necessary to keep the spine really flexible and to keep the discs hydrated. At age 21 or so, these arteries completely close off, so that our discs literally get no more oxygen or nutrients or blood supply for the rest of our life. So at age 21, our spine already is in a situation that is more precarious and more susceptible to becoming degenerated and to becoming brittle and dried out. The discs in our spine are like little cushions, little shock absorbers, like sponges. What happens if you take a sponge and you squeeze it, and then you put it in water and you release it? The water seeps into the sponge. Well, you can have a similar effect happening with the discs of your spine, where if you could squish them and then release them, they would absorb water and nutrients and fluid from the surrounding areas. That's what these exercises do. They literally pump and squeeze your discs so that they start to acquire all of this nutrition from around them, nutrition that is no longer coming after age 21. So what I want you to do is, if you will separate a little bit so you have a little bit of elbow room, I want you to do the exercises with me. I'm going to give them to you in a handout, but I want you to experience them as I'm doing them here too. So let's see. Oscar, do you want to move out a little bit so that maybe you can move this way, because she has no place to go. Stuck. And yeah, just put your chair a little bit out here, and let's go ahead and do these exercises. Okay, so pretend that I was sitting in a nice chair. Okay, so the first exercise has to do with the first two movements that our spine can do. Our spine can only move in 6 ways. That's it. It can move forward and backward, it can move rotating side to side, or it can move flexing side to side. That's it. These exercises will address all 6 of these movements. So let's start with the rotational movement. So go ahead and put up your hands right here. You want to sit right here so you have more room?
Come on.
You're going to bump her with your elbow. Okay, so the first exercise is literally just twisting your spine from side to side. I want you to pick a spot behind the wall, in the wall behind you, and try to look at that spot every time that you turn your head. At the beginning you may not be able to, and that's okay. Go as far as you can, and each day you will notice that your spine is going to have a little bit more and more mobility. I want you to try something. I want you to slouch, and then try that exercise in a slouching position. Can you see how that's not doing anything at all? So you have to be in a nice, you have to be really aligned in order for that exercise to do that amount of torsion that we want. Okay, so you're going to do 50 repetitions of it, meaning 25 to each side. The second one is going to address the side-to-side movement of your spine. So you just let your arms hang loose on the sides. You're going to sit up nice and straight, and leading with your head, you're just going to bend to one side and to the other side. So your head leads, but your whole spine follows that movement. If you sit on a stool or on the edge of your bed, on the corner of your bed, that's the best place, so you don't have anything that's keeping you from the movement. Let's try this movement in a slouching position. See? It doesn't happen. So you do 25 to each side, meaning you're going to count to 50. The last one addresses the forward and backward movement of your spine. So you literally just let yourself completely go into a slouching position and then pretend that there's a wave coming up your spine that starts at the very bottom, and that wave is pushing each part of your spine forward, almost one bone at a time. And then it goes all the way to your neck. And then you slouch all the way down again. Start at the very bottom and just move one bone at a time, forward, 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 forward. And your shoulders and your neck. Okay? You might not be able to do all of them the right way, but just do the best you can. Do a little bit of movement, and then when the baby's born, then you teach the baby. Okay, the mistake that people make with this one is they do that. Okay, that's not it. It's you go into a C curve, and then you go slowly one bone at a time, one bone at a time, until you're completely back.
Okay.
So those are the 3 exercises. They literally will take you 5 minutes to do them. Try to do them every morning, because that's when most people really feel stiff and sore. As soon as you wake up in the morning, just sit on the corner of your bed, do these exercises, and then you can start your day. If you're having a particularly hard day where you know you've overdone it, sitting or slouching or doing things in the wrong position, just take 5 minutes and sit down and do the exercises. You won't believe the difference that it makes. Sometimes our spine starts to hurt, and then it's 10 o'clock in the morning and we're like, oh, this is too much. It becomes like a snowball, because throughout the day your spine just gets more and more and more tense. You can break that pattern. Whenever you start to feel that things are just starting to get really tight, break it and do the exercises, and it's like you start from scratch. Any questions?